Good afternoon. Today I want to tell you something about bariatric surgery. And this is something that has come new and something that's amazing. So everybody needs to know about it, whether they need it or not, for their own knowledge and for telling others about this amazing new surgery. We all know that we have a lot of problems with obesity, and one of the most common problems that we see is the cosmetic problem. People want to look great, but then the fat comes in their way, and so they're always looking for a cosmetic procedure to make them look great. But weight loss is necessary for a whole lot of other reasons, because obesity brings in diabetes, it brings in a lot of other problems, including stroke, hypertension, depression, breathing problems, heart diseases, joint pains, and of course, many other diseases like a hernia. Now, we know that fat can cause a whole lot of problems involving almost every organ in the body. And this is because it's not just a deposition of nutrition in the body, but it is because we know that fat cells are like endocrine organs. They secrete a lot of hormones, and as long as we have the normal amount of fat, everything looks good. But the minute we have excess of these hormones being secreted because of excessive fat, everything can go wrong. So how do we measure this? How do we know a person is fat? We have this formula which tells us about how much a person should weigh, and this is a very scientific way of knowing about it. The WHO calculates obesity based on their body mass index, or BMI. A body mass index is basically a formula which looks at the height and weight of a person. The weight of a person should be measured in kgs, the height should be measured in meters. Weight in kgs divided by height in meters by square gives a person's BMI. And basically, the BMI should be between 18.5 and 25. If somebody is less than 18.5, they are supposed to be underweight, and somebody who's more than 25 is overweight. And obesity is something defined as BMI of more than 30. And today we see a lot of people becoming obese, and they're slowly becoming more and more obese. So we have classifications of obesity. Class 1 obesity is 30 to 35 BMI. 35 to 40 becomes class 2 obesity, and class 3 is more than 40 BMI, which means that the risk of health goes on increasing with more and more fat deposited in them. And once it reaches class 3 obesity, it's also called morbid obesity, or obesity which is enough to cause health problems. So what do we have today to get out of obesity? Weight loss is simply got by two different activities. One is diet and exercise. There are more than 1,500 books written today about different diets, different exercises, and still these are the two most proven methods to lose weight. We certainly have a few medicines. Medicines help people to lose weight, but not much. Hardly 5 to 10% of weight can be lost using medicines. And medicines do not cause permanent weight loss. We get back whatever weight we've lost when we stop these medicines. So, for a person who's not able to lose weight, for a person who's getting sick, who's having too much weight, and it is just not possible to manage, we have surgery. And this surgery is what is called as bariatric surgery. Baros means weight. So, a surgery that is meant to reduce weight is called bariatric surgery. So, this is not something new. We've had bariatric surgeries being performed since many years. Since obesity is nothing new, though we see more of it today in the general population. Since 1954, a whole lot of procedures have been tried, and we have looked at the results, what causes more weight loss and also is quite safe. And all these procedures are basically designed to reduce the capacity of the stomach, and a person eating less food and still having satiety, and at the same time making sure that people do not absorb all the food that they are eating by bypassing some amount of the small intestines which are required to absorb food. Today, the most simple surgery that is very effective and that can be used at every age and even in sick patients is this surgery called sleeve gastrectomy. And in this surgery, the stomach is stapled and made thin. A fat stomach is made thin, and this makes sure that people eat less food, they're full of energy because they lose a lot of bad hormones, and they're also increased metabolism in the body after this sleeve gastrectomy. The gold standard of all bariatric surgery has been a surgery called Roux-En-Y gastric bypass. And in this surgery, what we do is we cut the stomach into two parts, make a small stomach, and then connect the small stomach to the intestine. No part of the body is removed. This is a reversible surgery if required, and this gives wonderful results. Anybody who's not been able to lose weight, who's not okay at all, both mentally, physically, can undergo this type of surgery. There are a lot of myths about surgery. People feel that if they get into these surgeries, get and undergo these surgeries, they have to take a lot of rest. No, this is a keyhole surgery, and they will be up and about within 6 hours after surgery, and they're kept in the hospital just for 3 days, and within a week's time they go back to their normal work just like any other laparoscopic surgery. Eating, people feel that they cannot eat if they undergo surgery, which is again wrong, and some people feel they have to throw up all the time and they don't have enough quantity. All this is a myth. There is reduction in the quantity of food that they eat, but they don't feel tired and they don't feel hungry. And that's the beauty of it, because with this less amount of food, they're still able to manage all their energy levels, and they do not have to worry about anything else at all. People feel they lose hair. Of course, people lose hair when they fall sick, when they have fever, when they go on a diet. Whenever they're trying to lose weight, they lose a little bit of hair. But then this happens because they're not taking enough vitamins and proteins. As long as we maintain giving supplements of proteins and vitamins and minerals, they definitely do not have to lose weight of their hair. And a lot of people are worried about sagging of their skin, because they feel that after losing weight, a big paunch is going to droop down and then it's going to stay that way. But then what is important to understand is there is going to be exercising that is required, and exercising and toning of muscles when they're losing weight is going to help them to shrink their skin, and definitely sagging, which is there during obesity, with their obesity, comes down after they undergo surgery, lose weight, and they exercise. Weight regain is another big problem that people feel will happen with any surgery. So why undergo a surgery? But then what they need to realize is weight loss surgery is meant for weight loss and also to help them maintain what they've lost. So it's very easy for people to prevent weight regain by doing a little bit of exercise, eating healthy food after their weight loss surgery. A lot of people feel if they're eating less, they cannot conceive. But what they need to realize is obesity is what prevents them from conceiving. After weight loss surgery, we see a very good result in fertility rates. There is a very high fertility rate because all the bad hormones go away. Polycystic ovarian syndrome is cured, and they definitely do well because the extra fat that is there in the tubes blocking the eggs and sperms traveling towards each other is possible once the fat dissolves and goes away. People feel that they cannot do their activities, but that's wrong. They're very active. In fact, they have 3 to 4 times more energy after these surgeries. And there's a whole lot of people feeling there is life risk because there can be some leak of the staple line and there can be things like pulmonary embolism. But of course, doctors do take all the necessary precautions and make it a very safe surgery. And because of this, you see that the life risk is much less in bariatric surgery when compared to many other regular surgeries that are being done today, whether it is abdominal surgery for an intestine removal or a stomach removal or pancreatic surgery or a heart surgery. Definitely bariatric surgery is much safer than most of them. This is another slide that tells you that there is a lot of statistics that has been collected. Common surgeries like a hip replacement, a CABG that is being done today almost in every town is much more riskier than undergoing a bariatric surgery. The good thing is we have a small keyhole surgery which is done through very tiny incisions of 5 millimeters to 10 millimeters, and people get better very fast. They get to look much better. They get back very good cosmetic results, losing all their obesity. They can resume work very fast. Within a week's time, they're back to work, to doing everything that they were doing before surgery. And they have very satisfactory long-term weight loss, which no other method that we know today can offer. There is something that they have to be very jovial and celebrate, and that is all the diseases that are associated with obesity like hypertension, diabetes, arthritis, and many others get resolved, and people do not have these diseases. They don't have to take tablets for these diseases, and all this causes an improvement in the quality of life. In fact, patients go home the next day after they start their liquid diet with a few band-aids on their abdomen, and this band-aids stay there for a week's time, after which they're absolutely normal. This is a slide which has been from a research paper, one of the most well-read papers from the findings of the pioneer of gastric bypass surgery in the USA, Dr. Whitgrew, who did the first laparoscopic Roux-En-Y gastric bypass in the world. showed that in his first 500 patients, 92% of patients, there was a cure of hypertension. Their BP became normal after surgery. 95% of patients had improvement in their heart function. People who had severe osteoarthritis, 82% of them started walking normally without pain, and they did not require any joint replacements after this surgery because of weight loss. Sleep apnea is a very big problem, and this is a silent killer. A lot of people die silently in the night because of sleep apnea, and it is cured in 75% of patients without any treatment after bariatric surgery. A lot of people, especially ladies, have a huge social problems because they lose control over urination. When they sneeze and cough, there is some leak of urine, and that prevents them from going out of the house. They start staying at home all the time, shunning from going to any functions. And this stress incontinence is mainly because of obesity, and once they lose weight, 87% of patients do not have this problem anymore, and they do not need any special surgery for stress urinary incontinence. Acidity has become a major problem, especially in the obese, and almost all of them are cured of acidity, and their cholesterol also comes down. But the most important thing that I want to tell you is about diabetes. 95% of the first 500 patients who were operated showed that their diabetes came under control, and they did not require to take insulin and tablets anymore all their life. In fact, diabetes is usually gone before patients leave the hospital. Today surgery is done. Tomorrow a patient does not have diabetes and does not require any tablets or insulin. And this is not because of weight loss. This is because of a lot of hormones changing in the body after this surgery. In fact, today we are operating on patients doing a modified bariatric surgery, and this we call it metabolic surgery. This is done for people who have diabetes and who want to stop all their medicines and still keep their sugars normal. And so this is great news about bariatric surgery. Thank you.